Rivers State will survive the siege. Our people must surmount the surge. Come, proclaim and defend our unbreakable spirit, so we can renew our communal covenant. This is River State, where peace reverberates in solemn resonance, where the passion for life glows beyond the twilight, where life is a rhythm, a music with echoes of fraternal melodies. A rivers of excellence beckons beyond belief.
Stewardship with SNB.
Stewardship with SNB. It's probing.
You want to kill, you want to bury. What is it all about?
Beckoning on you occupying that public office to give account of your stewardship.
To be that quiet, he's the executive governor of this state and he's the leader and head of our party.
Politics on the menu.
I don't know what will happen. The governor leads, whatever directive he brings, I will follow.
What about the surprises?
Action that I've accepted to follow will be taken for my witness. I will surprise them.
Watch Stewardship at 12:30 p.m. on weekdays. Stewardship with SNB, a new trajectory to broadcast journalism. Join us.
Monkeypox or Mpox is an infectious disease caused by the monkeypox virus. It can cause a painful rash, enlarged lymph nodes, fever, headache, muscle ache, back pain, and low energy.
Mpox spread from an infected person to an uninfected person through skin-to-skin contact, kissing, sex, and contact with body fluids, including saliva.
Monkeypox can also be transmitted by sharing sharp objects and also from a mother to a child during pregnancies and childbirth. It can also be transmitted by sharing clothes with an infected person.
Monkeypox can also be transmitted from an infected animal to humans. Contracting monkeypox during pregnancy can be dangerous to the fetus or unborn infant and can lead to pregnancy loss, stillbirth, death of the newborn, and complications for the mother.
Now, common symptoms of Mpox are rashes, fever, sore throat, headache, muscle ache, back pain, low energy, and swollen limb.
Children, people with low immune system, men having sex with men, and those with multiple sex partners, including close family friends that are infected.
Remember, monkeypox has no cure but is preventable. So if you or any member of your household observes any of the symptoms mentioned above, please go to the nearest hospital.
This message is from the River State Ministry of Health.
Stewardship with SNB. Hello and welcome to this special interview session on Rstv Portagat. My name is Solomon Nelson Braid. Recently, the River State government won the Best Primary Healthcare Service Delivery Award in the South, of course, second in Nigeria, through the instrumentality of the River State Primary Healthcare Management Board. Yes, the roving career lens of Stewardship with SNB caught up with Professor KINIKANWO, a senior lecturer and consultant, Department of Obstetrics and Gynecology, University of Port Harcourt, who doubles as the Executive Secretary, Primary Healthcare Management Board. Professor Green, welcome to our program.
Thank you.
All right, what are the criteria for determining the winner of the Best Primary Healthcare Service Delivery State? And what did you do differently in all of these years past that you won the award?
Okay, thank you, Braid. Well, the criteria for winning this award, of course, you know that this award is from UNICEF, Bill and Melinda Gates Foundation, and Aliko Dangote Foundation. We have about 12 set criteria. That is, these criteria, they are assessed by an independent assessment team ranging from governance of primary health care, structures, to physical infrastructures, to immunization, to human resources for health and all that. These are all the various components that were assessed, and of course, by virtue of the criteria that were set and the set standards, Rivers State was adjudged the best in South-South, and of course we came second in the nation with the award cutting of $500,000 as the award. Yeah.
Okay, how did the governor receive the award?
Come again?
How did the governor receive this award?
Oh, he was very, very elated. He was very happy. That also underscores the importance that the governor of Rivers State places on health, especially primary health care. So he received it with, warm, open hands and all that, and he was very happy. And of course, he charged us to ensure that moving forward, we take the top position nationally. And of course, this board is poised to ensuring that Rivers State is always in the news for good reasons.
Okay, one thing is winning an award, another thing is sustaining the tempo.
Yeah.
How do you intend to sustain the tempo of this service delivery at the primary health care level?
So, well, of course, we will definitely sustain the tempo because, by the time having won this award, we expect that. In fact, let me also quickly say that this is like back to back, because last year we won it, and this is the second time running that Rivers State is winning this award. So the tempo will definitely be sustained, and as I said earlier, we are moving forward to the positive trajectory, and we expect to come tops in the entire federation by the next time this assessment is done. It's not easy, but of course it's with hard work. By dint of hard work, we've gotten to this position. Hard work from top to bottom. There are still challenges along the lines, and that is where we need to still focus on the various gaps, the various areas. Now, one other good thing about this assessment is that it has helped to bring out those areas that need strengthening, and of course, as a board, we are working around the clock to ensure that we strengthen those gaps that have been identified even by this award. So it's a win-win situation for Rivers State. Apart from the award that we have won, areas of that we need to sort out have also been identified, and this board is ensuring that those areas, those gaps are bridged and closed.
Now, considering the need of Nigerian doctors overseas, what incentives do you have for young doctors to remain at the lower rung, at the primary healthcare centers to do their work?
Well, we are aware of what the Japa syndrome and all that. But of course, you still find out that even working here, you can still compare yourself with any person around the world. And by the time you look at the incentives that the government is giving, of course, in terms of salary, in terms of maybe other welfare packages and all that, and you will have that zeal that, okay, you're closer home, you're closer to your people, and you're rendering that service to your people. So we have classmates that are also abroad, and we know that it is not as easy as some persons also sound. So we encourage younger colleagues to also be around, work with the government, while we also will continue to interface with the government to ensure that the government also does what they are supposed to do in terms of welfare packages, salaries, and other forms of emolument to the young doctors, not just the young doctors, nurses, and other health workers.
Okay, talking about doctors' welfare and all of that. Recently, RSU graduated a first set of medical doctors. Of course, you will agree with me that most of them were on government scholarship, and they graduated from that school. What is the plan of government concerning these doctors?
Well, the plan of government, especially those that are being on scholarship, as a young doctor, once you graduate from school, the first thing you do is to do housemanship. I know that as at this week, the process of commencing housemanship has already started. And once once you complete your house job, you do your youth service, and at that point you determine what exactly you want as a medical doctor. Do you want to go and start working immediately? Do you want to go and do some form of specialization and all that? These are all things that are left to the individual peculiarities and all that. And of course, talking about welfare, let me also tell you now that His Excellency recently did a promotion interview, and this was a very big boost to the morale and motivation of the health workforce. So the promotion of, in fact, it was for about 10 years. For the past 10 years, no promotion interview has been done. So you can see now that some persons even had to move up by 3 steps. So some persons became directors and all that, and this was like a major boost to them, and it is already reflected in the fields, because initially when we came on board, the morale of persons were low. Oh, you've worked for 10 good years, nobody has been promoted. But kudos to our executive governor who approved this promotion, and as I speak to you, you started receiving their monies and everybody's happy. So this is motivation, and of course it has really boosted the morale, and to whom much is given, much is also expected. We also expect that these healthcare workers that have been promoted will also reciprocate by doing what they are supposed to do, be at your duty post at the right place at the right time, and don't be nasty to patients, high quality assurance and all that. And once this is done, you see that healthcare delivery in Rivers State would have been strengthened.
Yeah, doctor to patient ratio is still very low, going by the UN recommendations. How does this affect the primary healthcare sector in the state?
Well, yeah, of course. I mean, we know that generally there is the dearth of medical doctors. By the time you compare the ratio of doctors to patients, you see that it's still, well, a far cry. Yeah, it's still low, and but of course you can just remember that recently His Excellency Sasimila Ifubara employed 1,000 staff in Rivers State University Teaching Hospital and another 1,000 healthcare staff at the Rivers State Hospital Management Board. We have assurances that very soon that will also be done in the primary healthcare board. So once this is done, it will really help to bridge this gap you're talking about doctor-patient ratio, and it will also help to improve universal health coverage.
Could you tell us about the big catch-up vaccination program the government recently launched, to the level that the rural person can understand?
Okay, so the big catch-up is like an interventionist program that the government is doing to ensure that all the nooks and crannies of our environment is captured in terms of routine immunization. We don't want to see people that have what we call 0 dose to vaccination and all that. So at times, by the time you go to some slums, some marketplaces and all that, you see some of the people living in temporary residential areas. They don't take some of their children to health facilities. So the big catch-up is aimed at ensuring that we take these vaccinations to those areas to ensure that everybody is involved in terms of vaccination and immunization. And of course, by the time we do this you hear about herd immunity and all that. We'll ensure that immunity to all these childhood preventable diseases is of course brought under control.
All right, Prof. Recently the chairman of Degema local government area renovated and furnished the primary healthcare center there at Isukun, to a standard. Isn't that indicting to your agency, whose duty is it to renovate, equip health centers? Is it local government or the private healthcare management board under your tutelage?
Okay, thank you very much. And coincidentally, the chairman of the Degema local government area was the immediate past executive secretary of River State Primary Healthcare Management Board. He was here for 8 years. So it's not there is collaboration, there is synergy between River State Primary Healthcare Management Board and the local government councils. And that is why, even in the constitution of the board of River State Primary Healthcare Management Board, the chairman of ALGON is a member of the board. So all the activities that happen here, the chairman of ALGON, who is representing the chairman, they are all part of what we are doing. And of course, there is a synergy between the board and the local government. So it is the duty of both the local government as government to do it, and of course the board too, to synergize and ensure that we provide the best primary health care services for our people. Having constructed the primary health center in Isoku in Degema, of course we were there for the commissioning, and of course the health center has been handed over to the board. We will be the ones to provide staff, we'll be the ones to provide consumables, we'll be running the board.
But you won't refund these expenditures?
Come again.
You won't refund the money?
As I said earlier, it is a synergy.
Okay.
Do you understand? It's a collaborative effort. So you cannot be, we were aware he was doing what he was doing. And this is also spread across all the LGAs. And we encourage the chairman of council too, because health is one priority that must be given and must be brought to the limelight. We encourage other chairmen to ensure that health is prioritized in their scheme of things. And so we want to thank the Degema. It's not just tomorrow, we are going to Andoni local government area, where the chairman has also built 2 health centers. In Obiabo, I'm aware that the chairman is already building a health center around the Bulu area. So chairmen are doing things, and this is the collaboration that we are talking about. Do you understand? You will not just leave it to the hands of River State Primary Healthcare Management Board. No, because the government pays the salaries of these health workers, especially those that are the top cadre, while the local government also pays those that are the lower rung of the ladder. And so it is collaboration. So in terms of primary health care, there is collaboration between you talk of the state, the local government, you talk of the state government, you talk of the federal government, and you even talk of international partners, because we even have health centers that have been built by the federal government. So health is like in the concurrent list of local, state and federal, and of course a lot of partnerships from international organizations, from like the WHO, UNICEF and all that.
Stewardship with SNB.
Monkeypox or Mpox is an infectious disease caused by the monkeypox virus. It can cause a painful rash, enlarged lymph nodes, fever, headache, muscle ache, back pain, and low energy.
Mpox spread from an infected person to an uninfected person through skin-to-skin contact, kissing, sex, and contact with body fluids, including saliva.
Monkeypox can also be transmitted by sharing sharp objects and also from a mother to a child during pregnancies and childbirth. It can also be transmitted by sharing clothes with an infected person.
Monkeypox can also be transmitted from an infected animal to humans. Contracting monkeypox during pregnancy can be dangerous to the fetus or unborn infant and can lead to pregnancy loss, stillbirth, death of the newborn, and complications for the mother.
Now, common symptoms of Mpox are rashes, fever, sore throat, headache, muscle ache, back pain, low energy, and swollen limb.
Children, people with low immune system, men having sex with men, and those with multiple sex partners, including close family friends that are infected.
Remember, monkeypox has no cure but is preventable. So if you or any member of your household observes any of the symptoms mentioned above, please go to the nearest hospital.
This message is from the Rivers State Ministry of Health.
Stewardship with SNB. Do you know the doctor-to-patient ratio in real estate?
Well, the current one now, I may not be able to give you that. But of course, you know that in terms of the particular, I will not be able to give you any particular figure right now in this interview. But Rivers State has done very well compared to other states. So I will score us high in terms of even that the ratio, but there's still need for more doctors, there's still need for more health workers to be injected into the system to improve our healthcare delivery space.
So what feedback do you receive from work ethics from your staff at the rural areas?
Okay, well, yeah, I mean, in terms of feedback, we receive all sorts. I mean, it's still a human system, it's not a perfect one. You see some people, they don't go to work, some people, of course, absenteeism, going to work late, being rude to some of the patients, some of these things still happen. But of course, at the board level, we ensure that we take care of some of these things. A lot of punitive measures are meted out to those that are found culpable in their line of duty. And routinely, we visit the health centers. We have a special unit called the supervision unit that go around the nooks and crannies of all the health centers in Rivers State. And again, you know that the way we are structured, we have the facility level. The facility levels report to the local government, and the person in charge of the local government health authority is the medical officer of health, who directly interfaces with us. So when there are issues, the medical officer of health flags it, and of course they are quickly sorted out. And so we know that some of the challenges include, some people think, the health centers are for only women, mother and child and all that, but we say no. Health center is for everybody, the men, the youths. In fact, we initially had the adolescent clinic and gender-based violence clinic in 4 health centers in Rivers State. One is in Orogun Health Center. The other one is in Eliozu Health Center. Then in the rural, we have one in Abua Health Center. Now, considering the importance of gender-based violence and how it has eaten deep into the fabrics of our society, we have decided to take this round the 23 LGAs, and we have people that are trained to ensure that they counsel some of the victims that may be, some of the victims of this menace, and how to counsel them psychologically and otherwise. So we are doing quite a lot in the primary healthcare space to ensure that things are normal, especially those primary healthcare services that have been hitherto have been swept under the carpet. We want to bring them out and ensure that our people are aware of some of these services. In fact, let me also tell you that recently we launched the primary mental health program. We also have the basic obstetric program. We want to ensure that in our health facilities, these programs are done. Now, we have been able to prioritize our health facilities to ensure that in each local government area, there is a prioritized health facility that has, the compendium of these various services. And once we have them, just as we have now, you see that our people can access these various programs that fall under the purview of primary healthcare system.
Prof, you're an award-winning executive secretary, and of course your agency too. Rivers State government wouldn't have been celebrating it without your instrumentality. Are there challenges confronting you at the rural level, the primary healthcare sector? Are there challenges?
Well, first, let me thank you for the accolades and also say that, it's a holistic one. Not just, we have a board, we have a board chairman, Professor Blessing Jaja. Of course, this team is led by the Honorable Commissioner of Health in the person of Dr. Adeze Chidima Ore. We've had a very wonderful collaborative effort, and I mean, she's leading right from the front. The Deputy Governor of Rivers State, Professor Ngozi Maodu, DSSRS, is the chairman of Rivers State Task Force on Primary Health. And quarterly we hold meetings to review all the issues, all the challenges about primary health. And these are the various levels of authority that have really strengthened primary health in Rivers State. Of course, the governor of the state is the number one, the key person who provides all the funds that we are using to fly. Without him, we will not do what we are doing. So we want to thank all of them for the collaboration that we are having. In terms of challenges, if I say there are no challenges, that won't be correct. There are challenges, and you expect that these challenges are there and will be sorted out. Challenges even in terms of human resource for health. We are aware that we need more manpower. We need more doctors in the system. We need more nurses. We need more healthcare workers. But again, the good thing, as I said, is that the governor has given us that assurance that these people will be employed very soon. Just the same way they have done for Rivers State University Teaching Hospital and the Hospital Management Board. Because these are, when the people know that they are doctors and health workers, they will also now tend to come. So these are some of the challenges. We still have, pockets of, in some cultural practices, some of our traditional practices, especially in the rural area, they are still there. You still need to, go the extra mile to talk to our people to ensure that they attend facilities. Some of them will still prefer the traditional birth attendant. They will still prefer do some of those cultural practices like female genital mutilation and all that. But of course, with advocacy, with a lot of talks and all that, we have been able to send these messages down to the grassroots. And again, as I said, it's a continuous process. We are still on it, and our eyes are still focused on the ball. At the end of the day, we want a situation whereby primary health care in Rivers State will not just be the best in Nigeria, we'll be competing with other climes. That is where we are heading to. Yes, that is where we are heading to, and we have the capacity to get to that level.
Interesting.
Yeah.
Prof, what is the state policy on nutrition? Could you tell us about it? Recently, the state government launched a state policy on nutrition.
Yeah. So, nutrition has been identified as a major part in terms of primary health care and in terms of health generally, because if you're malnourished, you have complications of malnutrition, you don't expect to grow well, be it from kwashiorkor, from marasmus and all that. Now, recently, after a very long time, the governor of Rivers State signed you didn't tell me, he signed the policy on food and nutrition, the multi-sectorial policy on food and nutrition, and that was a great feat, having not been done for over 10 years. So we thank him again for coming out to sign this document. Now this document has provided us that template to ensure that nutrition issues are sent to the grassroots. Already a nutrition committee has been set up in the states, in all the 23 local government areas. The vice chairman of council are the heads of nutrition committee, and they go round. Nutrition doesn't just begin and end with food. It starts from in terms of food, what you're planting on the ground, the seeds. How do we store this? The storage of these seeds. How do they grow? So you see, nutrition is like a multi-sectoral thing. It doesn't just involve the healthcare worker. It involves Ministry of Budget, involves Ministry of Agriculture, Ministry of Health, Ministry of Education, because you need to educate people about nutrition for them to know the importance of nutrition. And nutrition has been brought to limelight. And of course, Rivers State Primary Healthcare Management Board is at the center of it all, ensuring that the message of nutrition is carried to all the nooks and crannies. Now, again, let me also draw your attention to the fact that considering the economy, the poor economy is also, we are now seeing some of the patients that we had, cured before in terms of malnutrition, in terms of underweight and all that. But again, if you compare the statistics from Rivers State to the statistics from other parts of the country, you still see that Rivers State is still blazing the trail in terms of nutrition services, and we'll continue to do that. We'll continue to advocate to our people. Recently, we have people like Professor Nte, who is a UNICEF certified, of course, consultant professor of pediatrics, who came recently to do a training for us for exclusive breastfeeding. We launched the exclusive breastfeeding week, that's the baby friendly hospital initiative, from 1st to 7th of August. And within this period, the importance of exclusive breastfeeding was brought to limelight. And as I speak to you now, all the medical officers of health and other reproductive health officers were trained on how to ensure that this training is trickled down to the various local governments of Rivers State. So for nutrition, we are
That's okay. All right. Just before we draw the curtains, let me throw this question, and maybe right or wrong, Prof. But if I'm right, you tell me. If I'm wrong too, you can also tell me. There appears to be no noticeable and aggressive, vigorous campaign against intake of illicit drugs in our society, and of course in the local areas as well. And this has eaten very deep into the very fabrics of our lives as a people. What's your take on it?
Okay, well, in terms of illicit drugs, of course, we have government agencies that are saddled with that responsibility. I know that NAFDAC have state offices, and I'm aware that some of these illicit drugs that are abused by, youths is something that is eating deep, and I know that NAFDAC is also on top of it. Now, what are the consequences of it? It gets to various forms of societal deviances, mental health issues and all that. And that is why we as a board recognize this fact and now brought in the primary health mental health program that I told you about. So this helps to remove stigmatization of these persons. Now, you don't just take them to only maybe UPTH or Rivers State University Teaching Hospital. By the time they get there, they would have had series of complications associated with that, and that is why it's usually better you catch them right from the milieu, right from the communities. You see some of these people, you take care of them. Now we go to some of the town hall meetings. We meet some of the church leaders. We meet some of the traditional leaders and all that. We have health talks with some of them, telling them about the harms and the dangers of some of these practices that can hamper somebody's life. So I agree with you that this is something that is in our society. All hands must be on deck to ensure that this menace is eradicated. From the primary health angle, we are on top of the situation.
Prof, what do you envisage for improvement? Do you envisage any improvements for the primary healthcare management sector this year?
Definitely. About 3 weeks ago, the Deputy Governor of Rivers State, Professor Ngozi Modu, who represented the Governor of Rivers State, Sasimela Ifumara, launched the 135 primary healthcare comprehensive renovation. This is since after the creation of this board, this is the first intentional, aggressive renovation that is being carried out now to this tune of 135. So this will positively impact positively impact on the primary health centers. You are aware that recently the board commissioned, of course still through the deputy governor, we commissioned the solarized in various local government areas to ensure that what we are giving to our children are not expired drugs or expired vaccines. Now again, of course, you are aware that vaccine vial crushers, vehicles were also launched. We launched about 9 Hilux vehicles spread around the 23 LGAs. This is even the first phase. We will do another phase and will ensure that mobility is not a challenge again for primary health care, because mobility is very important. You need this, you need mobility to ensure that these vaccines are sent to the grassroots. And when you don't, when they tell you, the motor has broken down, I mean, it will become a problem. But this has really ensured that that area is gone. We also bought motorcycles for disease surveillance officers, especially in the hard to reach areas. As I said earlier, this is the first phase. It's going to be a continuous process, and of course, definitely, the board will be happy for it, and Rivers people will also be happy for it.
Prof, I'm pretty sure your eyes are still on the board to win more laurels for the state and for the agency.
Definitely.
Is there any other thing you want to add? Is there any other thing you want to add?
Well, yeah, I mean, what I want to say is generally we want to use this opportunity to admonish our people and to tell them that primary health care is a very important gateway in terms of healthcare delivery in Rivers State and generally around the world. Primary health care will take care of the child, will take care of the mother, will take care of the father, will take care of the elderly. So it's important that they access care in our PHCs. Now, it is not yet uhu. There are still challenges. You may go, oh, this nurse didn't do well, didn't smile well at me and all that. That is why we are having, that is why we are even having this conversation. We are running an open government whereby if you have challenges, please come directly to us. We will sort it out immediately. So, access care, we have 344 health centers in Rivers State, and they may not be in terms of they may not be at the best state, but of course you can see that a lot is being done to revitalize these health facilities. We have done, right from when we came on board, we have revitalized over 60 primary health centers. Having done this, the government is already doing 135. If you add 60 to 135, that's like almost 190, 195. And it will be, as I said, it's a continuous process. It's a continuum, and the only thing is that we are heading to the primary health care El Dorado in Rivers State.
Okay, final one. Your policies also cover people living with disabilities. Because recently I interviewed an advocacy group who came to my studio, and then they were saying that they do not have they have problem with accessibility, to facilities and all of that. Does your policy cover?
Yeah, it does. I mean, in terms of primary health care, if you don't cover people living with disability, it's not done well. Now, take a critical analysis of the model primary health centers that we have in Rivers State. You will see that there are provisions for ramps and all that. And of course, this is especially for those that are living with disability, those that are maybe cannot walk on wheelchair and all that. And I mean, other forms of disability. And let me also tell you that we interface with all the segments of the society, and we even send primary healthcare services to some of these people that are challenged. So yes, the policy covers them.
All right, Prof. We understand that you have equipment to distribute to the various local government areas. What are these equipments, and when are you distributing them?
Yeah, thank you very much. As part of our effort in strengthening primary health care, because if you don't have the requisite equipment to take care of your people, that means you've not really done anything. So the the state has also acquired a lot of medical equipment. within us here, and they're going to be distributed around the nooks and crannies of the state, around the 23 local government areas, the primary health centers.
What nature of medical equipment are they?
So a whole wide range. A needs assessment was done, and from health facility to health facility, we did a needs assessment, noting where they have gaps. And these gaps were noted, and of course, we're now able to procure medical equipment from hospital beds to sphygmomanometers, to stethoscope, to BP measuring machines, the phones, just name them. We will take you around, and this medical equipment will definitely be utilized in all our healthcare facilities. Now, even we were able to do what we call mama packs for pregnant women, so that once they deliver, the mama pack contains delivery items, towel clip, towels, suction, nasal suctions and all that. All these are contained in the mama pack, and we are going to give each pregnant woman a pack of it, free of charge. So, and that is why we encourage our pregnant women to go and register for antenatal care in our health facilities. And once they deliver, the delivery is free. By the government. We also have, of course, the reef chip, the insurance arm of the health insurance that pays for the pay capitation and fee for service. So it is only just a win-win situation for everybody. When you go outside there, you will see a lot of the medical equipment that have been procured by the state. And in the next 2 weeks, once we get the next batch of consignment by next week, in 2 weeks time, we'll start distributing to all the health centers in all the states.
Okay, Senior Lecturer at Professor KINIKANWO, Senior Lecturer and Consultant, Department of Obstetrics and Gynecology, University of Port Harcourt, who is also the Chairman, Executive Secretary now, River State Primary Healthcare Management Board. Professor KINIKANWO, thank you so much for your time with us.
Thank you.
All right, that's our program today. Join us again same time. We'll bring you another guest on a different topic. My name is Solomon Nelson. Bye-bye. Stewardship with SNB.
Monkeypox or Mpox is an infectious disease caused by the monkeypox virus. It can cause a painful rash, enlarged lymph nodes, fever, headache, muscle ache, back pain, and low energy.
Mpox spread from an infected person to an uninfected person through skin-to-skin contact, kissing, sex, and contact with body fluids, including saliva.
Monkeypox can also be transmitted by sharing sharp objects and also from a mother to a child during pregnancies and childbirth. It can also be transmitted by sharing foods with an infected person.
Monkeypox can also be transmitted from an infected animal to humans. Contracting monkeypox during pregnancy can be dangerous to the fetus or unborn infant and can lead to pregnancy loss, stillbirth, death of the newborn, and complications for the mother.
Now, common symptoms of Mpox are rashes, fever, sore throat, headache, muscle ache, back pain, low energy, and swollen limb.
Children, people with low immune system, men having sex with men, and those with multiple sex partners, including close family friends that are infected.
Remember, monkeypox has no cure but is preventable. So if you or any member of your household observes any of the symptoms mentioned above, please go to the nearest hospital.
This message is from the River State Ministry of Health.
Stewardship with SNB. It's probing.
You want to kill, you want to bury. What is it all about?
beckoning on you occupying that public office to give account of your stewardship.
To be that point, he's the executive governor of this state and he's the leader and head of our party.
Politics on the menu.
I don't know what will happen. The governor leads, whatever directive he brings, I will follow.
What about the surprises?
Action that I've accepted to follow will be taken for my witness. I will surprise them.
Watch Stewardship at 12:30 p.m. on weekdays. Stewardship with SNB, a new trajectory to broadcast journalism. Join us.
Stewardship with SNB.